Okay.
Hi, Mrs. Smith. How are you? I'm going to come and do an assessment on you, and then when I get done with your assessment, I'm going to do one on your baby, and then we're going to give her erythromycin ointment on her eyes and the vitamin K shot in her thigh on the vastus lateralis muscle. And usually we would do this like pretty close to after she was born, so I guess maybe this is pretty close to after she was born. But anyways, I'm going to shut the door to provide privacy, wash my hands, put on my gloves, and then can I just have you verify your name and your birth date? Okay, let me make sure that your band matches with mine, and then I'm also at this time going to make sure that the baby's identification matches the mom's as well. So let's see. Yep, everything matches, and then the tag that's on my baby matches as well. Okay, so how are you doing? That was a good birth, huh? So I'm going to start with your vital signs. So I'm going to take your blood pressure, and it was like 117/65, which is really good. That's a good blood pressure. Normal range is like 120/60 to 140/, I think it either 140/90 or 140/80. So anyway, you're in good ranges. Your respirations are 20, which is good. We want them to be between 16 and 20, maybe even lower than that. I can't remember. And then we put the pulse ox on your hand, and your oxygen is 95, which is great. We want it to be between 90 and 100%. And then your temperature, we took your temperature and you were at 99, which is okay. We like it to be between 98.6 and 100.3. Above 100.4 is a temperature, and so it's okay that your temperature is a little elevated. You just had a baby. Your body's going through a lot of things. So anyways, I'm going to check your breasts just to see if your nipples are sore, if they're tender, if your milk is starting to come in. So your breasts, they're tender, and your nipples are, they're not inverted or flat. I know the word isn't extroverted, but anyways, close enough. They're good nipples for breastfeeding. So I'm gonna listen to your heart and your lungs real quick, and then we'll just kind of move down your body. Okay, I'm gonna have you take a deep breath in and out, in and out. Perfect. So I would listen to 6 spots on the front, and I would have her roll over and do 6 spots on the back. And then I'm gonna listen to let's see. I'm gonna listen to a couple areas of her heart. Then we'll go over to pulmonic and tricuspid. No. All of the points. And then we'll get down here to listen to PMI. Perfect. Your heart sounds good. I don't hear any murmurs. Your lungs sound clear and equal bilaterally. So now I'm going to come down and just check your stomach. So I'm checking to feel your fundus to see where it is at. And so I want it at the line of, I want it to be right at your umbilicus. And so it feels good. It feels about right at behind your belly button. And it is firm. And I'm just kind of looking at your pad as we push on your fundus to see if any clots come out. Your bleeding looks appropriate for just having a baby. There's some small clots, and we just want you to report if you have a clot that's bigger than your fist, or if you're having like excruciating pain. And as your uterus shrinks and contracts back up, you're gonna have contractions still, especially where this is your 3rd baby. The after pains are a little worse because your uterus gets a little more stretched out every time. And so I'm just gonna look down here. You didn't tear, which is super great, but you are swollen. And so right now I'm checking for Rita. So redness, ecchymosis, there's another E. It's like, I can't remember it. And then I'm looking for drainage and approximation, which you didn't have any stitches. You did good. So with your pad, there's not a lot, like there's a lot of bleeding, but you're not feeling it over 15 minutes. And so have you been able to get up and go to the bathroom? You didn't have a C-section, you had a vaginal birth, and your epidural is wore off. You've been able to get up and go to the bathroom, okay? Is there any burning when you pee? Okay, yes, that's expected, just because you had a baby. Have you been able to pass gas? Okay, perfect. So it looks like you just have a pad on right now. And so let me hurry and teach you real quick what we're going to actually do. So next time you get up and go to the bathroom, here, let me change my gloves real quick. Since we checked your perineum. But next time you get up and go to the bathroom, let me know, and I'll come help you put this padsicle together. And it's really helpful for swelling and for pain. And so how we put a padsicle together is we get our ice pack right here, and we open it, and there's a little like a little baggie in there, and you pop that bag open and it makes this really cold, okay? And then we're going to open this up, and we always put the pad on top of the ice pack so that it's not in direct contact with your skin, okay? So we'll open the pad, we'll take off the sticky and put it right on. And then we have these, and here are some postpartum panties. I'll help you put the pad in here. This will help the pad stay on you. And so we have this awesome thing. We're going to put down our Tux pads. And they like to call it a Subway sandwich, but that kind of makes me not want to ever eat Subway. So I just call it a padsicle. So we just put down 3 or 4. And then we're going to put down this Duvocaine ointment. And this is for hemorrhoids mostly, and I noticed that you didn't have any hemorrhoids, which is super awesome. But it also has some lidocaine in it, and so it will help to numb everything. So you just kind of put a little squirt down the middle. And then this is Dermoplast spray. This is my favorite thing when I had my first baby and my second. I think I went to the store, I think I bought like 5 cans of this before I had my baby because I was just so panicked that I wouldn't have enough. So you can either spray this on the pad before you pull up your pants, or you can spray it directly on your perineum. And then before you do any of that, when you're getting ready to go to the bathroom, you take this bottle and you just fill it with warm water, not hot, not cold, but just comfortable. And then as you're after you're done using the bathroom, you use this to rinse yourself off. And then with the toilet paper or with the wipes that are provided, you just want to pat yourself dry. You don't ever want to wipe because that tissue is it's just so raw and irritated from having a baby. So anyways, we'll put this back together and put it back in your bathroom so you'll know where it is. And then we call these bum meds. So if you need any more bum meds, just let me know, and I can get you as many as you need. And it's just very helpful for swelling and everything. So I'm going to come back here and I'm just going to check your legs. Up here looks good. I'm not seeing any thrombitis. And then I'm going to come check your reflexes. Just looking for clonus, which would happen if you were preeclamptic. So I'm going to check right here your patellar reflex, which is good. Okay, and then just push against me. Okay, good job. And then just while I'm checking reflexes for fun, can you squeeze my hands? Okay, perfect. Your reflexes are all good. They're equal bilaterally. Okay, so how are you doing with your baby? Are you loving on her? Are you kissing her? Are you making eye contact and talking to her? You feel like you're bonding well. You're not feeling any detachment from her at this time. Okay. Can you tell me how breastfeeding is going? Has she been able to latch pretty good? I know you've had 2 babies previously and you breastfed great, you told me, but next time you breastfeed, let me know. We'll come in and do a latch score. And that just looks at how she's latching, if she's able to get any milk, if we can hear her sucking. Let's see, what's T? Goodness, when it comes down to it, I can't remember. The C is comfort, so if everything is comfort, and then the H is the hold, like how you're holding her. And what hold were you most comfortable with? You were most comfortable with the football hold? Does that feel comfortable when you're feeding her? Okay, perfect. All right, so now I'm going to move on to your baby. I'm just going to wash my hands again before I pick her up. Have you come up with a name for her yet? No, she's just baby girl Smith. Okay, that's all right. And then before I start the infant assessment, if Mrs. Smith had had a C-section, I would assess her IV site, which I should have assessed her IV site anyways because she just had a baby, so she still has her IV in. So we'll come over here and just check your IV site really quick. It looks dry and not irritated. It doesn't look like there is any phlebitis. And then if I was giving her medications, I would flush it and make sure that everything was patent. And then I would teach her about when she showers, to put a pad across her incision and to not stand directly towards the shower. Okay, and then I would talk to her about when she gets her staples removed and all the education that comes with that. So now I'm going to come and I'm going to grab her little baby, which if she had just had her daughter, she would be handed to me and we would dry her off. And as we're drying her off, she can be on the mother's chest as we're doing all of these cares. And so we're gonna dry her off and make sure that we keep her warm. And as we're doing that, I'm checking, I'm turning her head and checking to see how that's going. I'm checking to see if her ears line up with her eyes. I'm feeling it will come to me. I'm feeling for the soft spots on her head to see if they are swollen or sunken in. Okay, I'm gonna have you hold your baby real quick. Gonna grab all of my stuff. And then, so I've dried her and we would just suck her mouth and then we would suck each nostril. And then I would see if I could feel that her nostrils were patent, which was good. We dried her body. So while she's on your chest, Mama, I'm just going to, oh, I guess we didn't put on, we'll put on her band, which I don't know how you put this on a baby. Anyways, we would put on her ID band and make sure that it matches yours. And if I had a measuring tape, I would, oh, here it is. I would measure her head, and we can make sure to go from the bottom up to the top. And her head is about 13 inches, which is good. And after I do that, I'm going to put her hat on to make sure that we don't lose any heat. Okay, perfect. And then keep holding her. You're doing so good. We'll measure around. And as I'm doing this, I'm able to look at her back. I'm looking at her head for any molding or cephalehematomas or capit. I'm looking here at her back for Mongolian spots. Oh, I notice on her thigh she has a birthmark. You have a birthmark on your thigh too? Wow, that is so amazing. She's your baby. Okay, so I'm going to measure, and she is a perfect baby. Her abdomen, we measure it by her belly button. Her abdomen is 13 inches too. Okay, good job. Okay, so I'm gonna take her over here. I'm gonna weigh her. We'll put on a diaper and we'll do her eyes and thighs really quick. And so we talked about what the eyes and thighs mean. So we put the erythromycin in her eyes to help her to not get an infection in her eyes from something she could have encountered in the birth canal. And then we give her the vitamin K injection to help her clot, because that is not something that she is able to do. So we'll come over here and I will take the towel off and we'll get a weight on her. And while she's right here, I'm always keeping my hand on the baby to make sure she's not going to fall off. We'll get her length at 18 inches and her length. And her weight is around 7 pounds. So that's wonderful. Okay, so we're going to get a diaper on her really quick so that we can track when she has her first meconium or her first wet diaper. And you've been able to breastfeed her, so that should be any time within the first 24 hours. Okay, so I'm going to have my other nurse hold her while I drop her medication real quick. We have her in the warmer, so she's warm. I'm going to get her vitamin K and her erythromycin. Oh. And then we're going to finish doing her vital signs while she's laying right here, just to get a baseline. Let's see, here's my vitamin K. Okay. So her blood pressure, it was good. It can be from, let's see, I think it's 30/60, no, other way. Yeah, no, 60/30 to 90/60, I think is the range, and she's good. I'm going to get her temperature. She's laying under the warmer, and she is good at 98. Her respirations are good. They need to be from, I think, like 40 to 60. And then her heart rate is, I think, from 140 to 160 is a good heart rate for her. Okay, so we're gonna clean out her eyes. We'll pretend that this is our washcloth, and we go from inside to outside. And then we're going to apply the erythromycin ointment, and we apply it from inside to outside. And then I'm going to wash my hands. Oh, change my gloves before I do her injection, and wash my hands just to keep the risk of infection down. Maybe I'll get bigger gloves. Alright, she's in the warmer. The sides are up, so she is just fine. I'm losing my stethoscope. Okay. So we did her eyes, and now we're going to give her her thigh injection. So where her birthmark is on the left side, I'll do her injection on the right side of her vastus lateralis. I don't know if it really affects anything, but just to be safe. So we'll rub the spot for 15 to 30 seconds. We'll let it dry naturally. And the order is for 1 gram of the vitamin K. And so that is 0.5 of a mil. So we'll, whoop, my needle came off. So we'll pull that up and give her her injection. Goodness. Okay. And where she is so little, I always want to double check with my nurse to make sure that we're the same.
Good.
0.5 of a mil. So I come and I would give it at a 90-degree angle into the muscle. Okay. And then I go and I throw it away in my sharps container without recapping. Okay. I put the Band-Aid on. Okay. What else? Oh, and we're going to assess for just how she's moving. And I would assess for the Babinski reflex, which makes her toes go like that. And then I would assess for the Moro reflex, which is the startle reflex that makes her jump. And then I would also assess for the rooting reflex. So I would come right here, and she turns her head towards me. Okay, little baby, what else do we have to do with you? We need to get you back to your mama, that's for sure. Okay, so as I take her from the warmer, I'm gonna get her, I'm just gonna take her straight to mom. She needs to have some more skin to skin. So I'll bring her into mom. Okay, we're gonna have her do some skin to skin on you. And then in a little bit we'll have her breastfeed. Okay, so I have you holding her. Okay, and so then I would come in and do your latch score. Everything looks good. If you, oh, one thing I forgot to assess. So I'm looking for swaddle menstruation because she's a girl. So sometimes your hormones in your body will make her have a little bit of like swaddle menstruation. So she's not really menstruating, it's just a little like tinged mucus, and she looks good. Her labia, everything looks fine. The outer one's larger than the inner one, and her clitoris is good. Her bum hole is patent. And then her hips, they move fine. I don't hear any clicking. And then as we go down our last couple things that we're trying not to forget, we'll check for any crackles or crepitus. But she had a normal birth. There wasn't any birth trauma. Her head doesn't look molded at all. She looks pretty good. And let's just check her sucking reflex really fast. Oh, she's hungry. We better help you get her on. Okay, do you have any questions for me? All right, well, I'm gonna leave you two to breastfeed, and you push your button and let me know if you need anything. Thank you so much.
You done?
Yeah.